So the first thing I want to talk about is one of our vasoactive drips, norepinephrine or levophed. It's one of our alpha agonists that we use for vasoconstriction in patients who are hypotensive. It's a weight-based drug. It comes in standard concentration 8 milligrams in a 250 cc bag of saline. The titration is 0.02 micrograms per kilogram per minute up to 0.3, or it could be a higher dose based on your physician's order. This medication is available in double or quadruple concentration. And one of the misconceptions that it has is if we double concentrate this medication or quadruple concentrate this medication, that the patient itself is receiving a double or a quadruple dosage of that medication. This is a false and common misconception. Because it is weight-based, the patient does not actually receive any higher dosage of the medication. If you have a patient who is 100 plus kilograms, 150 kilograms, what happens is you actually have an increase in the flow rate. So how fast is your drip actually running to the patient? So if you have someone who's on the upper end of 150 kilograms on a moderate dose of levophed, you could potentially have your flow rate of the infusion at 100 cc's per hour. And in a patient like this, you're running through a bag of levophed every 2.5 hours. So, and sometimes even higher than that. So one reason we actually double concentrate or quadruple concentrate this medication is simply to reduce the flow rate. So double concentration would be 16 milligrams of levophed in a 250 cc bag. And if your flow rate is running at 100 cc's and you double concentrate it, then you're actually going to be getting the same dosage to the patient based on their weight. However, you would reduce the flow rate by 50% and be running it now at 50 cc's per hour. If you quadruple that medication, what would happen is it would reduce it by 4, increasing the amount of levophed in the bag at 32 milligrams per 250 cc bag, but you're adjusting your pump and it's reducing the flow rate to 25 cc's per hour. So two reasons why we do this. One, sometimes it is better for the nurses, so you're not changing the bag every hour or 2 hours, going through 6 bags of levophed in a shift. Or if volume is an issue for the patient. So say we're trying to really stay low on the volume, someone's volume overload by double or quad concentrating the levophed, you can actually get less volume to the patient. And so that could be helpful in some cases. One important concept to know is whenever you're actually changing these drips over, patients can be very dependent and reliant on the actual flow rate itself. When you titrate drips, you actually have two changes. You have a flow rate concentration change and then a drug concentration change. So I've had patients where they're on levophed and I've got a carrier fluid with it, and the physician had come around and said, hey, stop those IV fluids. So I reduced it to a KVO, and just by slowing that actual flow rate down, the flow of which the patient was getting the medication can actually cause your patient to have some hemodynamic disequilibrium, and you can have low blood pressure after that. So just remember, by reducing the flow rate, you may experience some hypotension during that transition because you're reducing the rate in which the patient's getting the drug. Ways to kind of help with this. It's important that anytime you're transitioning from standard to double to quad, that you always have a new pump, the concentration which is being added, so double, it's primed with new tubing, and that you make sure that you have it correctly in your pump. Sometimes making sure that your patient has a cushion, so you're not transitioning them from standard concentration to double concentration, reducing the flow rate by 50% when your blood pressure is 79/40. So maybe trying to have some sort of cushion of a blood pressure before you do that transition. And then I personally typically do not order for a patient to be from standard to quad concentration if they're extremely labile or reliant on that medication, because just reducing that flow rate by 4 times can be a considerable reduction in flow rate, and you can have profound hypotension following that. So that's my tidbit of information about levophed and the differences in those concentrations. If you guys have any questions, please let me know.